Is there an agreed upon model for yoga therapy?
There really is an agreed upon model. And the reason you'd want to be clear on that is so when someone says, oh, you do yoga therapy, you know, I talked to this other guy who does yoga therapy, you know, you guys do the exact same thing and work on the same model. And that's not actually true, right? So in yoga therapy, there's a bunch of different ways people approach it, all based in yoga, you know, but they're not the same. Similar, but not the same. So if you went to somebody who was trained in like the Iyengar tradition for yoga therapy and got a bunch of sessions and got certain types of results and then wanted to explore, and then they came to you, right? You're going to do something very different than what the Iyengar people did.
Right, right.
You know, and that's weird for the public because we're kind of used to just going to the doctor and they're all working off the same script, right?
Right.
If you go to 3 different PCPs, you'll probably get a similar kind of thing happening, right? Where they take a blood test and they look for certain markers and it's pretty much the same no matter where you are, you know, they check your cholesterol levels, you know, but we're different in the IAYT process, which we're going through now. It's like, you have to talk about these things, right? You have to talk about the koshas, like your students need to know about these things, but it doesn't say that your students need to know how to like look at a condition and process it through the koshas, because lots of schools don't do that. Right. So that's interesting. You know what I mean?
Well, and then I guess my question about that would be, what's the difference of looking at it in a koshic framework different from looking at it with like a chakra balance?
They're different.
Well, I know, like,
right?
Well, like,
you'll come to different conclusions, maybe.
So then do you do much work with the chakras?
A little bit, but no. I mean, not in the foundations course.
Okay.
Because you can only have so many models running at the same time, right? Right. So you could go in with a whole chakra orientation. I also think, just because we're there, it's a lot easier for people to understand the koshas than the chakras. Like in terms as like a conceptual framework for healing themselves. Because there's more of a buy-in with the chakras. Do you know what I mean? There's more of like you have to really sometimes shift your belief system.
Okay.
When you talk to people about the koshas, you're like, well, you know, you have a physical body, and then you have like your thoughts, and everyone's like, oh yeah, I do have thoughts. You know, it's an easier perception, right? And then you have the part of you that watches your thoughts. So you might have not thought about that, but if we do a couple quick meditations, you'll quickly see that that's true, right?
Right.
You know what I mean? And then we have this other energetic body stuff that's maybe a little bit more of a buy-in, but we use the breath a lot, so that's not hard. So, you know, when working with people, it's sometimes a lot easier than saying, well, here's this chakra model. The way I usually end up using the chakra model is actually doing things from the chakra model, but not explaining it to the person I'm working with. Just sort of doing it, right? Have an experience and then tell me if you feel better, right? Instead of like, let's talk about your chakra system, and here's the fourth chakra, and here's the sound. I usually more like, you know, the cell is more usually like, there's a tradition in this. I'm going to give you something to chant, right? And some a way to do it, and so that's out of that system, but not so much working right off that model. Just remember, this might help, that these are all models, right? They're conceptual models for the same things.